Welcome to Journey to 600. Today we're going to talk about vestibular differential diagnosis. First, we'll review the difference between central versus peripheral dysfunction and then go into some other diagnoses such as BPPV, unilateral vestibular hypofunction, bilateral vestibular hypofunction, acoustic neuroma, Meniere's disease, ototoxicity, and otitis media. So breaking down central versus peripheral, we're going to look at the nystagmus first. So let's just compare what is different, and it's kind of lined up to make that comparison. But on the peripheral side, you're going to have unidirectional nystagmus in a horizontal direction, but for central, it'll be vertical and pendular directions. For central, there will be no inhibition with visual fixation, but with peripheral, there will be inhibition with visual fixation. And then lastly, you have significant vertigo with peripheral, but very mild vertigo with central. Next, looking specifically at the vertigo, so peripheral, you will have a short duration of the vertigo with some auditory fullness, tinnitus, autonomic symptoms present, such as like pallor and sweating. With central, you'll have more of those neurosymptoms, so like diplopia, anopsia, weakness, numbness, ataxia, and dysarthria. And then talking about the diagnosis, so central diagnoses are things like migraines, meningitis, trauma, tumor, cerebellar degeneration, and multiple sclerosis. But a lot of the ones that we're going to be talking about today are the peripheral, such as BPPV, Meniere's, infection, and things like that. So starting off, we're going to talk about BPPV, and BPPV is caused when the otoconia displaces into the semicircular canal. Classic presentation is positional vertigo that lasts for a short period, along with nystagmus and nausea and vomiting. Management is based on which semicircular canal is affected. Check out our more detailed video on BPPV. What is the difference between unilateral vestibular hypofunction and bilateral vestibular hypofunction? So the what is it is pretty easy. So you either have an impairment of one ear or an impairment in both ears. While unilateral presents with more dizziness and vertigo with poor balance, bilateral has more disequilibrium and gait ataxia, but they will both have impaired VOR and benefit from vestibular rehabilitation, starting with gaze stabilization exercises that work on the VOR, the vestibular ocular reflex. Next, acoustic neuroma. So this is just a tumor on the vestibular nerve that presents with tinnitus, hearing loss, unsteadiness, loss of balance, dizziness, and facial numbness. Meniere's disease, it is basically like glaucoma of the ear, so you have some increased pressure and distortion of the sensory receptors, and it presents with tinnitus, deafness, vertigo for 30 or more minutes, and oral fullness. Ototoxicity can be due to medications that lead to ear damage that presents with tinnitus, hearing loss, and vertigo. This is just an ear infection that presents with fever and ear pain. And now time for a practice question. So a patient presents with complaints of tinnitus, hearing loss, vertigo lasting for an hour, pressure in the ear. During the examination, you determine a normal gait with no loss of balance. Based on these findings, the patient is most likely to have which condition? A. Benign paroxysmal positional vertigo. B. Acoustic neuroma. C. Meniere's disease. D. Bilateral vestibular hypofunction. I'll give you a moment to look this over. If you're not ready to go over the answers, please pause. So this question is asking the patient is most likely to have which condition. So let's go over what all these conditions are. BPPV has positional short vertigo, so this does not match what is in the question because it is vertigo lasting for an hour. Acoustic neuroma, let's see, it does have tinnitus like our question, and it does have hearing loss, but they will have a loss of balance and dizziness, but you observe no loss of balance. So acoustic neuroma is looking like not the best answer. We'll skip down to bilateral vestibular hypofunction that presents with oscillopsia, which is visual blurring with head movements and gait ataxia, but you observe normal gait, so this is not the correct answer. So going back, what is Meniere's disease? So it actually does fit this full picture. It presents with tinnitus, hearing loss, vertigo lasting longer than 30 minutes, and they report pressure in the ear. So C is the correct answer, Meniere's disease. So in summary, today we talked about the difference between central and peripheral dysfunction, and we highlighted what the nystagmus and vertigo and different diagnoses are, central versus peripheral. And then we had a differential diagnosis based on presentation, and we talked about various vestibular diagnoses, look back over all the diagnoses, and highlight what makes them different. For a chart of these diagnoses, check out the link to the notes on Etsy. Thanks so much for watching. Don't forget to like this video, subscribe to our channel, and turn on notifications. See you next time on your journey to 600.